What does gastric mean? It's a restricted procedure. That means when the patient eats, the patient will feel full very fast. We don't cut the stomach. We perform invagination of the stomach. Invagination. That means that the gastric lumen is very small, very small. It's small than gastric bypass, the pouch, is small than the sleeve gastrectomy. We perform imbrication of the stomach. And another advantage, reversible. This will be important. Finally, if the patient doesn't want the procedure, the stomach will be complete. We need to cut all the sutures. Yes, we are very excited because we have a new procedure. The name is Plication. It's a restricted procedure like a sleeve gastrectomy, but I told you that we are very excited because when you talk about overweight surgical procedure, you need to talk about 2 points. Number one, results, and second, complication. In this case, our results in the first year are similar to the gastric bypass with sleeve gastrectomy. This is very important for the patient. We are talking about excess weight loss. And the other point is complications. In this kind of surgery, we don't cut the stomach. That means that we are not going to have the worst complication. I'm talking about the leaks. We can avoid the leaks. The second point is to avoid the bleeding of the staple line. Finally, we have a new procedure with good results and less complication. In this hospital, Hospital Angeles, we perform all kinds of overweight surgical procedure, but this will be one more with excellent results and less complications. This is the key. This is the key because remember, obesity is life-threatening, but to perform in some cases overweight surgical procedure can be very difficult, and we can produce some complications. We need to avoid complications. We need to have less invasive procedure with good results. In bariatric surgery, we need to be less invasive. Gastric bypass, I love, but it's an invasive procedure. A sleeve gastrectomy as well. I like to perform a sleeve gastrectomy, but we need to remove 80% of the stomach. With this procedure, we'll be less invasive, means less complication, with results similar to gastric bypass and the sleeve gastrectomy. You compare with that bad, another excellent procedure, no device. This is important. This is important because we have some complication regarding with the device. All the patients are candidates for this kind of procedure. Remember, we compare with gastric bypass and a sleeve gastrectomy. Most of the patients we can perform this procedure. Advantage is less invasive. For example, in all patients in our group, we don't perform gastric bypass. I'm talking about 60 years old or more. With this procedure, you can perform because you can avoid complications. Our first patient, after 6 months, they had similar results to gastric bypass. It's one of the reasons we are very excited. I'm sure this procedure is one of the future. It's one of the future for all kind of patients. This is an excellent procedure for all kind of patients. Now, in this moment, we are going to start to train some American surgeons in this procedure because they believe in the procedure and they want to do the procedure.